Dependent personality disorder, or DPD, is a chronic mental health condition that affects the way individuals relate to others. It's marked by an overwhelming need to be taken care of, leading to submissive, clingy behavior and intense fears of separation. This disorder can severely impact personal, social, and work life, as those with DPD struggle to function independently. Often they experience anxiety, depression, and a constant need for reassurance from those around them. In this video, we'll explore the definition, symptoms, causes, and various treatment options available for dependent personality disorder. DPD is classified under Cluster C personality disorders in the DSM-5, a group of disorders known for anxious and fearful behaviors. At the core of DPD is a deep psychological dependence on others for emotional and physical needs. People with DPD often feel inadequate and helpless when left to make decisions on their own. This disorder typically manifests in early adulthood and affects men and women equally. However, societal expectations may lead to higher diagnoses in women. According to the DSM-5, the defining feature of DPD is a pervasive and excessive need to be taken care of, which leads to clinginess and fear of separation. Individuals with DPD often avoid responsibilities or decisions, even when they're simple, relying on others to take charge. The fear of abandonment causes a pattern of compliance and submission, preventing them from expressing disagreement or asserting their own needs. The symptoms of DPD create a long-standing pattern of dependency and affect nearly every aspect of a person's life. Some of the key symptoms include: 1. Difficulty making decisions. People with DPD often struggle to make even the simplest decisions without excessive reassurance. For instance, they may rely on others to help them decide what to wear or what to eat, seeking advice for things most would consider routine. This lack of confidence in their own abilities leads to an overwhelming dependence on a partner, family member, or friend to guide them through day-to-day choices. A fear of being alone. Individuals with dependent personality disorder are often terrified of being abandoned. The mere thought of being left alone can cause extreme anxiety, which leads them to stay in unhealthy relationships or form new attachments very quickly when one ends. This constant fear of isolation makes it difficult for them to live independently. Submissive and clingy behavior. In relationships, people with dependent personality disorder may exhibit highly submissive behavior, constantly seeking approval and reassurance. They often put the needs and desires of others ahead of their own to avoid conflict or rejection. As a result, they are vulnerable to being manipulated or exploited. Difficulty expressing disagreement. Fear of losing support makes it very difficult for people with dependent personality disorder to express disagreement. Even when they feel strongly about something, they may suppress their opinions or defer to others. This reluctance to assert themselves often leads to a lack of fulfillment in relationships, as their own needs are not addressed. Difficulty starting tasks alone. Another hallmark of DPD is an inability to initiate tasks or projects independently. These individuals may avoid taking on responsibilities because they don't believe they can succeed without guidance. This results in missed opportunities for personal growth and development. Urgently seeking new relationships. When a close relationship ends, individuals with DPD tend to seek out a new relationship immediately. The fear of being left alone can drive them into new relationships, even unhealthy ones, to avoid the discomfort of being on their own. Tolerating mistreatment or abuse. The fear of abandonment can lead people with DPD to tolerate mistreatment or abuse. They often stay in harmful situations because they believe it's better to endure pain than to be left alone. Pessimism and lack of self-confidence. Dependent personality disorder is often accompanied by feelings of helplessness and a pervasive sense of pessimism. Individuals with the disorder may underestimate their abilities and potential, further driving their need for external validation. Preoccupation with fears of being left alone. One of the most challenging aspects of dependent personality disorder is the constant preoccupation with the fear of being abandoned. These fears, even if irrational, cause significant distress and often dominate the individual's thoughts. The exact cause of dependent personality disorder is not entirely understood, but researchers believe it's likely due to a combination of genetic, environmental, and psychological factors. Some key contributing factors include genetic factors. Studies suggest that personality disorders like dependent personality disorder or DPD may run in families, indicating a possible genetic predisposition. If an individual has a family history of DPD or similar disorders, they may be more likely to develop the condition. Early childhood experiences. Childhood experiences, particularly relationships with caregivers, can play a major role in the development of DPD. Overprotective or authoritarian parenting styles, where a child's independence is discouraged, may contribute to feelings of helplessness and a strong reliance on others. Conversely, children who experience neglect or separation from caregivers might develop fears of abandonment, which can manifest later as dependency. Cultural and social factors. In some cultures, dependency and submissiveness are reinforced, especially for women. Social norms and gender roles can influence how people develop dependent behaviors, making it more acceptable or expected in certain contexts. Attachment issues. Individuals with dependent personality disorder often exhibit insecure attachment styles. These may result from inconsistent caregiving or a lack of emotional support during critical developmental periods, which can lead to problems with forming balanced, healthy relationships as adults. Diagnosing dependent personality disorder involves a comprehensive psychological evaluation. Mental health professionals use criteria from the DSM-5, which require that at least 5 of the key traits of DPD be present. These traits include difficulty making decisions without reassurance, fear of being alone, and difficulty expressing disagreement, among others. A proper diagnosis also considers the individual's history and behavior patterns. Fortunately, treatment can significantly improve the quality of life for individuals with dependent personality disorder. The primary goal is to help individuals build greater independence and self-confidence. Here are some common treatment options. Psychotherapy, cognitive behavioral therapy, or CBT, is the most effective approach for dependent personality disorder, or DPD. It helps individuals identify and challenge their dependency behaviors, build confidence, and learn to make decisions independently. Other forms of therapy, such as psychodynamic therapy, can explore the emotional roots of dependency, often linked to early childhood experiences. Medication. While no medication specifically treats DPD, medications like antidepressants or anti-anxiety drugs may help manage symptoms like depression and anxiety, which often accompany DPD. These medications are usually prescribed alongside therapy. Assertiveness training. Assertiveness training helps individuals with DPD learn how to express their needs and opinions confidently. It teaches effective communication, reducing their submissiveness and allowing them to establish healthier relationships. Group therapy can provide a supportive environment for individuals with dependent personality disorder. Here, they can practice interpersonal skills, receive feedback from others, and learn that they're not alone in their struggles. Family or couples therapy. Since dependent personality disorder often affects personal relationships, family or couples therapy can help address unhealthy dynamics and encourage more independence within the relationship. Building self-esteem. Therapy also focuses on improving self-esteem by encouraging individuals to recognize their strengths and celebrate achievements. This helps them build confidence and take on new responsibilities with greater independence. Dependent personality disorder is a challenging condition, but with the right treatment, individuals can develop the skills they need to live more independently. Therapy combined with medication, assertiveness training, and lifestyle changes can significantly improve their ability to function in daily life. If you or someone you know is struggling with dependent personality disorder, seeking professional help is the first step toward healing and growth. Subscribe to our channel for more insights on mental health and well-being, and stay tuned for future videos.